and then sold.
Very little. Part of the problem with public health is, I know opiate addiction is our current problem. A year and a half ago, it was methamphetamine. A year and a half before that, it was, it's cocaine and designer drugs. We have a tremendous amount of designer drugs coming over from China that are used by our youth in our society. So, I think we need to look personally. I think we need to look at the addiction thing, especially drugs, as a bigger picture. And not, once again, I don't want to put things in silos. Because once again, sure, we may tackle a little bit of opiate addictions, but then again, our methamphetamine rates and addictions start rocking up. Yes, and then we'll have alcohol, which came out yesterday, I believe, from the CDC, and, which we sometimes like to neglect as a public health and health in general. But those are very serious issues that we all need to kind of look at as a whole. And I think this assessment brought out, like I mentioned earlier, great opportunity to see what does Joel have as far as data sets are concerned in the county and cities and stuff in the city of Kent. So no, these are bigger picture items that I think we need to start to pool our resources, like Kelly mentioned, and our thoughts together. A lot of interventions we use in public health, we like to use obviously research-based interventions. A lot of them come from like there's a task force for preventative services, like the community guidance stuff. These are new ventures for us, kind of opiate addictions and some of that. We understand a little bit on how to combat smoking now. Pretty good. There's enough research on that, but the opiates, the meth, and some of the other designer drugs that, being in Kent, we'll go out on a complaint and we'll see baggies of stuff that I don't even recognize in various places. So, it's all coming over the internet, it's all coming from China, and as soon as they regulate one compound, they've already moved 3 steps ahead of it. So, this is something we need to all pull our resources together and our heads together and really start to combat this, because it's not getting any better. It just seems like every year or every 2 years they're moving to a cheaper alternative drug.
I think too that, as Kelly told you, we identified 155 needs. I think that's the right number. And we ended up getting them down to 9 groups. Well, you don't get a 9 group as opiate. So we're looking at a bigger picture. This is forcing us to look at the bigger picture. While we are addressing the needs of what's coming right now, that will help us in the long run with the bigger picture. But I think that's a real good point that Jeff made, that we don't want to continually fight fires. We want to be able to prevent those fires. I think that's what public health is all about, is prevention. The one thing I wanted to mention is that, for those of you that don't know, that Ohio is right now, first of all, the first and only state in our great United States to require health departments to become accredited. We have to apply for accreditation, our intent to apply by 2018, and we're supposed to be accredited by 2020. So, there is more than bureaucracy driving this now. It's our own survival that may be driving this. So, unless we want to be part of a larger conglomerate, we need to move forward, and we need to make these changes, especially in evidence space and those type of things. So to let you know that while we're all rah-rah, there is some driving force behind it too. Hospitals have to do it.
Any other comments?
Yes.
In the wellness and prevention section, although I do wait till I get the email to people, is one thing that was looked at in terms of wellness is activity, nutrition,
Apparently not, so.
Heather might be able to help us with that. She remembers that was something that was collected from one of the surveys. I don't think it was either.
well, that because it's under the people 2020. I chaired the sleep committee for the Ohio Adolescent Health Partnership, and that's now it's a newer concept to look at sleep and public health, although it's backed up. But we were the first partnership in the nation to identify sleep as a public health issue for adolescents.
consider it now on the agenda.
But yeah, CDC doctor wrote a
Right.
really good essay
Right.
last year.
There was a news story today about this as well.
Oh, was
So,
it?
yeah, so it's clearly timely, and nearly none of us are getting adequate amount of sleep. I think that's the finding. I don't want to encourage you to begin solving that just yet. We hope that instead you'll stay and have some conversation. We appreciate you coming out tonight. We know it was a pretty difficult day weather-wise. Thanks for coming, and please have something before you go.